All right, we'll go ahead and get this started. We're going to go ahead and start the Gallatin County COVID-19 press call on September 3rd, 12:30. Today we have on the call Lori Christenson, the Gallatin City County Health Officer. We also have Tracy Ellig, who's the Vice President of University Communications from Montana State University, and Kallie Kujawa from Bozeman Health. She's the COVID-19 Incident Command Lead. Go ahead, Lori.
All right, great. Thanks, Holly. Welcome, everyone. All right, I'm going to go ahead and start with our local epidemiology weekly surveillance reports. Okay. All right, you should see the surveillance report. Holly, if there's for some reason that people cannot see that, just give me a nod. But at this point, you can see here we are continuing to see a rise in our 7-day rolling average of daily cases per 100,000 residents. So in comparison to last week when we reported to this week, we have seen about a 36% increase from our last reporting. Also, in terms of our daily and 7-day average percent positivity rate, we're also seeing a little bit of an increase from where we were last year. Our 7-day rolling day average percent positive is 10% as of 8/31. And that is, again, an increase from where we were last reporting period, which was 8.5% positivity rate. And one thing I just want to mention about this now is the importance of being tested when you have symptoms. So if you're feeling sick, whether you're vaccinated or not, it's important to speak to a healthcare provider and consider getting tested, especially if it's just a mild symptom. Sometimes we are seeing even mild symptoms be COVID positive. And you can see here, we're still getting our the median time from a specimen collection to report to public health is still 1 day. So we're still seeing a good turnaround time for those tests. Again, as I mentioned just a few seconds ago, it's important to be tested because we are seeing a good turnaround time for that as well. In terms of our vaccination rates, we continue to see an increase in the number of individuals who are seeking a first dose or a second dose. And you can continue to see those percentage increases in each of the age groups. Again, our 12 to 17-year-old age group is continuing to see a good increase in the percent of individuals who have received a first dose, and then again, translating that into the number of individuals who are fully vaccinated. We certainly have a ways to go. We definitely need more individuals being vaccinated this time. Wanted to also share the number of active cases associated in our K-12 schools, as well as Montana State University. And I'll speak to this a little bit more in just a second. And then also, we continue to see high transmission in our community as well, in terms of the number of cases per 100,000. I'm going to stop share. Just a second. So I just wanted to bring up a couple of other couple of points that I want to make about our local epidemiology. The importance, again, of being tested when you're sick, and then the acknowledgement of the toll the pandemic continues to have on our healthcare workers. For our school-based testing, so the surveillance report information that we've included, I've gotten a couple of questions from our media partners, as well as parents and other concerned citizens. So just in terms of comparing where we were last year to this year. So when we look at the number of cases last year in comparison to this year, we need to keep in mind that the level of community transmission and the contagiousness of the Delta variant. So we are in a different type of a pandemic now in terms of the Delta variant. So in other words, when we're comparing this year to last year, it's like comparing apples to oranges, and we really can't make a fair comparison. So when the schools opened their doors last year, they did so during a time where we were experiencing when their schools are opening this year, they're doing so during a time where we're experiencing nearly 5 times higher community transmission. So specifically in September 1 of last year, we were seeing 49.7 cases per 100,000 over a 7-day period. And as of September 1st of this year, so 2021, we're experiencing 242.3 cases per 100,000 over the last 7-day period. Again, that's almost 5 times higher community transmission. And I want to recognize that it is concerning to see higher number of cases in general. And I absolutely understand our communities and our parents' concerns. So as a reminder, a layered mitigation strategy, including encouragement of vaccination amongst students, amongst employees who are eligible, wearing a mask, social distancing when able, staying home when you're sick, and getting tested if you're feeling sick, regardless of your vaccination status, all remain really important measures. And then, as I just mentioned too, and I mentioned previously, that it's important to be tested. So if you aren't feeling well, consult with your healthcare provider and seek testing to rule out COVID-19, and also determine if there's other concerning symptoms as well. You should be talking to your healthcare provider. And then lastly, but perhaps most importantly, speaking on behalf of our health department staff and our entire team here, I really want to acknowledge and thank our healthcare workers. It's been well over a year of dealing with highly emotional situations from patients, their families, the community. And we want you to know that we still see your daily activities and your daily sacrifices, and we appreciate you. So with that, I'm just going to turn it over to Kallie to speak about any Bozeman health updates. Kallie?
Excellent. Thanks so much, Lori. So for those of you who I don't know, I believe I know everyone, but just in case there are any new ones on this Friday press briefing, I'm Kallie Kujawa. I'm Bozeman Health's Incident Command Lead. I'm also the System Director for Quality and Safety for our health system. Currently, today we have 20 hospitalized patients confirmed positive for COVID-19. I believe I've shared this before, but I am saddened again to share with you that we have had our first pediatric patient hospitalized for COVID-19 in the previous month. In the month of August, we had 62 COVID-19 hospitalized patients. Of the adult patients who were hospitalized, the youngest was 19, the oldest was 81, and when we averaged the ages of our patients who were hospitalized, that average age was 59. Of the total, only 12 were vaccinated. That means 50 COVID-19 positive hospitalized patients were unvaccinated. Of all of those COVID-19 positive patients in the ICU that have required mechanical ventilation, let me state that one more time. All of the COVID-19 positive patients in the ICU that have required mechanical ventilation have been unvaccinated. I'm going to get a little frank with you, but hospitals and health systems do not get paid more money for COVID-19 patients. Hospitals and health systems do not get paid more money when a person passes away from COVID-19. Any allegations to the contrary are absolutely false, and spreading this information must be stopped. Caring for COVID positive or suspected positive patients requires transmission-based precautions, and that's in the form of airborne and contact precautions, which means putting on and taking off respirators, gowns, gloves, face and eye shields dozens of times per day by all who interact with these patients, which are extremely time intensive and very physically burdensome to the staff who have to wear those. All of these precautions are to protect our healthcare workers and their families who they go home to at night, and to protect, I'm sorry, I'm getting a little choked up. It's getting really tough again for us. And to protect the other patients that we serve. At Bozeman Health, every single person that works in healthcare does so because they feel called to care for others. Every person at Bozeman Health cares for every single patient, regardless of their vaccine status, with kindness, respect, and ensuring they receive the best possible care. When this kindness and respect are not reciprocated, It is hurtful, harmful, and extremely demoralizing. We are pleading for your help and partnership in preventing the spread of the transmission of COVID-19. Please get vaccinated. Bozeman Health has more than 2,400 employees. In a community our size, that means it is highly probable that every resident knows at least one of our employees. Help keep our healthcare workers safe and healthy. Help keep our community healthy. Help keep yourself healthy. I'll say it one more time. Please get vaccinated. Wear masks. Stay home when you don't feel well. Practice frequent hand hygiene. Thank you so much for your time.
Thank you, Kallie. Tracy, MSU.
My name is Tracy Ellig. I'm the Vice President of Communications for MSU. So it's been 1 week since we required masks in the classrooms, and we have seen incredible cooperation on behalf of our students. It has been very successful, and we're very grateful for our students, our faculty and staff for cooperating with us on this issue. We continue to do as much as we can to encourage students to get vaccinated. Thanks to our partnership with the Gallatin City County Health Department, next Friday, we will be having a mobile clinic right outside of Montana Hall, where students, faculty, and staff can walk up and get the Pfizer vaccine. And we will be launching a marketing campaign on Tuesday about the fact that the Pfizer vaccine is fully FDA approved. Because there has been widespread speculation, not only in our community, but across the nation, that there have been people waiting to get a vaccine because they wanted that full FDA approval. Now we have it. We're going to market heavily, and we hope we see a good turnout because students, faculty, and staff won't need to schedule something. They can just walk up, and that's next Friday on our mall. That is continues, just like Kallie said, vaccinate, vaccinate, vaccinate. That's really the most powerful tool we have, and we continue to push that to our students. Thanks.
Okay, thanks, Tracy. Thanks again, Kallie. Any questions today?
Hey, Lori, can you hear me?
I can, Annie, thanks.
Okay, there we go. I have a quick question for Kallie, and you can answer it or anyone can answer it. But what do you guys say to the people who are saying that the deaths are made up, people aren't dying? I think it came out today that 5 recent deaths have happened in Gallatin County. And of course, people troll us just as much as they troll you guys and say the media is making that number up. It's no such thing. What do you say to people like that?
Yeah, I think, as you'll note, I said we have 2,400 employees here, meaning the community probably knows someone who works at Bozeman Health. I would encourage you to talk to them and hear their side of the story. If you know our physicians, if you know our nurses, our respiratory therapists, our environmental services staff, all of the staff who ensure that we serve the needs of this community from a healthcare standpoint. If you talk to them, you will hear their stories, and I think you'll think otherwise.
Gotcha. I have a follow-up question to that.
Yeah.
For people who are dying from COVID, and I know you can't give out specific information, but in the majority of cases, are there underlying health issues that are contributing to the death, or is it mainly COVID?
Thank you for that question. We have a way of understanding what the primary diagnosis is of a patient. So if their primary diagnosis is respiratory illness related to SARS-CoV-2 or having the COVID illness, that would be their primary diagnosis, and we would capture that as a COVID-related death. Oftentimes, patients do have additional diagnoses, and as you alluded to, Annie, they have comorbidities, but that is with every patient who we serve here, all types of primary diagnoses. The majority of them do have comorbidities and potential secondary diagnoses, but of the reported deaths that are COVID related, their primary diagnosis is for the most part, as my understanding is, a respiratory related to coronavirus.
Perfect. Thank you so much.
Hi, this is Emma with NBC Montana. Can you guys hear me?
Yes, we can.
Okay, perfect. I was worried there that I hadn't unmuted myself all the way. So this is a question for Tracy. I know, Lori, you brought up that obviously we're in a totally different spot this year than we were last year with the advent of vaccines and a lot less community spread, but obviously we are still seeing an increase in cases. And so I think with that in mind, that it is a very different situation for you, Tracy, now that it's been a week back with MSU and students on campus learning in person. How has it felt this time around versus last year?
Emma, I knew you were going to ask this, but honestly, I've been struggling with this question. And just let me have a little bit of a running start here. I think all of us working on this, like 12 months ago feels like 12 years ago, because every single day is so intense, trying to navigate our way through this event. I would say that in general, there is a sense of somewhat more caution hope. Because if you remember, last fall, we did not have a vaccine. Now we do. And there was so much fear about what the virus could do and how it could just devastate our elderly populations. And fortunately, we're seeing incredibly high vaccination rates amongst the elderly. And that is one silver lining that helps me, and I know helps many on our campus, is that population does seem like it's in a far better place than it was 12 months ago. I'm not being very helpful here because I know you need a little clip for TV. Let me try one more time here. I'd say, overall, the sense is more hopeful, but there is still remaining this sense of anxiety about the spread of the Delta variant, and the struggle we continue to have to get people to vaccinate. We're in a much better place than we were 12 months ago, but we still have challenges ahead of us, and we're still all working very hard to meet those challenges, to keep our students, our faculty, our staff, and then in the case of Lori and Kallie, our entire community safe. Thanks.
Awesome. Thanks so much, Tracy. And I just had one other question, and I think this is one for Kallie. I know you mentioned just now when you were talking that of the hospitalized patients, you've recently seen your first pediatric patient hospitalized. And so I was just wondering if you could have any comment on that from the hospital's perspective, any reaction to how it felt to have seen the first very young person be hospitalized because of COVID?
I think with all of our patients, it's disheartening to see them have to be hospitalized for something that is potentially preventable by a vaccine if they are able to receive a vaccine. Regardless of their age, we definitely don't like to see our pediatric patients hospitalized for any reasons, especially those of us who have children of our own or know kids of the same age. I think it's challenging to see, but I feel like for any and all of our patients, it's challenging to see them be hospitalized for this.
Perfect. Thank you so much.
Other questions? Juliana.
Hi, I had a couple of questions. It was sad to see this morning that those 5 people had died. I'm curious though, if you know whether or not those people were vaccinated. I don't know if that's a question for Kallie or for Lori, I'm not sure, but.
Yeah, out of respect for the families, we're not going to release any further details.
Okay, sure. The other question, just because I wasn't here in Bozeman for most of the pandemic, that 40-year-old, I'm just curious if that's the youngest or one of the younger deaths we've seen here in Gallatin County. That seems pretty young to me. Yeah.
Thanks, Juliana, for your question. I don't have that information in front of me either. I can certainly see if I can find that for you.
Thank you. Those were my questions.
Thanks, Sam. Juliana, any questions, other questions out there today?
Lori, I have another quick question for Kallie.
Sure, Annie, go ahead.
Is the hospital seeing any patients from elsewhere, any other states?
We always see patients from elsewhere. I suppose our typical processes are, accepting patients from other locations if we have the space capability, if we have the staffing capability, and if we have the services and skill level that's required to care for that patient. We will absolutely accept patients from other locations. And we do that on a regular basis, even outside of the COVID diagnosis or respiratory COVID related diagnoses. So we accept patients based on their level of care and our ability to provide care for them. And we transfer patients if they require a level of care that we cannot provide here. So it's a typical thing we do all the time. I don't know that helps you, Annie.
I'm going to reword that question because I did ask a very broad question,
Yeah.
but do you know if any patients have been transported to Bozeman because that their hospitals are just full to capacity?
I don't have that exact information in front of me, but my guess is that but if I were to reflect on how that's happened in the past, before even today, that's a reason why they will transfer patients to another facility oftentimes, is if their bed capacity doesn't allow for it, or they don't have the appropriate level of trained staff to care for those patients. So if I look historically, that has been something that happens. And as far as knowing if that's happening at a very high level right now, I don't have that information in front of me.
Okay, thank you.
Yep.
Okay, other questions out there today? Okay, well, seeing none, thank you everyone for joining us again today. We appreciate the time that Kallie has spent with us too. I know she's very busy, as well as Tracy. So thank you so much for joining us again. And to all of you, please take care, and we'll see you again next week. Thanks.
Thank you,
Thank you guys
Lori.
so much. Enjoy the weekend.